Okay, we are ready to begin. As people trickle in, I'll just start us off with our housekeeping. Welcome everybody who's watching through Zoom and through Facebook. This is being recorded and a video will be available to everybody who registered for today. It'll also be available on Senior Matters on their webpage and on the library's social media sites. We're happy to be with Dr. Stakiw today and with Senior Matters. They will tell you all about the presentation, but before we start, I'd just like to take you through our Zoom functions. We are using Zoom webinar today, which means you can chat with our panelists and with our participants through the chat box or through the Q&A. If you have quick comments or you need help with the technology or have any issues with Zoom, please use the chat and I will be looking at that to fix it as soon as we can. If you have a question for Dr. Stakiw about the subject matter or her career or anything she goes over in her presentation, please use the Q&A. That will save your question so that we can answer it at the best appropriate time. With all that, I will go ahead and let Dr. Stakiw, Nancy, and Sue take over for me. I will be behind the scenes, making sure everything works. So thank you for being here. Nancy and Sue, would you like to say something before we begin?
I would just say thank you so much for coming. I know that there have been some buildup for this. There's a considerable interest, and that there will be, as Alex said, this will be available in several different venues so that people who are not able to show up right now can take advantage of it. And thank you so much for coming.
Look at me being muted. Dr. Stakiw, the presentation is yours.
All right, well, welcome everyone to a Senior Matters event. My name is Dr. Stakiw, and I am a board-certified doctor of audiology. I have lived in the Roaring Fork Valley since 2003 and have raised all 5 of my children with my husband here. I own Rocky Mountain Audiology here in Glenwood, and soon to be in Aspen Valley Hospital. And just a little bit about me is I love to travel in my free time, and I actually play pickleball all over the world in tournaments. So hopefully I will see some of you guys out there on the courts. So if we don't have any questions about me, we will kind of dive right into how hearing does affect our entire body or health. And we'll start with our first slide of just the main parts of the ear. If you would switch to the next slide. So this slide here shows the 3 main parts of the ear. So our external or outer ear, which collects and directs our sound in. It's also where our wax is produced. So if you look at that screen where all of those yellow or sebaceous cells are, that's where we actually produce our wax. The next part of the ear is the middle ear, and our eardrum is kind of what sets sound off into vibration, and then it then vibrates those little middle ear bones and turns all of that mechanical energy into electrical energy into the inner ear. So our cochlea or our hearing nerve, that big snail-shaped object there, is what transmits our sound into electrical energy and up to the auditory cortex of our brain. And the auditory cortex is going to be important during this conversation because that's what controls hearing and our understanding of speech and language. Next slide. So what causes hearing loss and how common is hearing loss? So it's definitely more common than you think. By age 65, 33% of us will have some form of hearing loss. And now that hearing loss can be caused by family genetics, noise exposure, certain treatment of cancer, medications, prescriptions, and then the aging process. But over 90% of us over the age of 80 have some form of hearing loss. which I think surprises some people because I know seeing patients every day that it takes the average patient about 7 years to come in for an evaluation. Next slide. So this is just some good statistics on hearing loss. So the vast majority of retired individuals are living with some form of hearing loss. I would presume that most of us here today are interested because we either suspect or know someone with a hearing loss in our life. So like I said, 33% of people over the age of 60 have hearing loss, but 1 in 6 of us between 40 and 60 have hearing loss, which I think is surprising for most people. Obviously, 1 in 14 of our Generation Xers already have hearing loss, and 3 out of every 1,000 babies are born with hearing loss, which leads us with 1.4 million children age 18 or younger with hearing loss. And obviously, we know this world is getting louder every day, and that definitely contributes to part of the hearing loss that we're seeing in our younger generations with the use of headphones, AirPods, and even video. Next slide. So the goal today is to really discuss how influencing hearing can be and how it can actually affect our huge areas of life. So this just shows that people with hearing loss that's left untreated actually end up being poorer drivers. And most people want to know, how is that? People with normal hearing perform better driving than people who have moderate or severe hearing loss. The reason being is as we have untreated hearing loss, our ability to have quick reflexes and make complex decisions is affected. And that's because our brain just isn't receiving enough information to make some of those big decisions as we're driving. Next slide. I think it is pretty new knowledge for most people to know that their cardiovascular health can be affected, as well as falls. So there are a variety of medical conditions in which hearing loss can be affected by, and we're going to talk kind of about the main ones there. So studies have shown a direct relationship between hearing health and a strong cardiovascular system. In fact, our health is so sensitive in our ears to blood flow that some researchers call the ear a window to the heart in predicting cardiovascular disease. So the presence or decline of hearing loss has been found to be a strong predictor of your cardiovascular health. And the reason being is that the blood vessels to the ear are so minute that when there's changes in our oxygen level or in our blood flow, though the ear is the first to show a sign to that. Also with falls, people with untreated hearing loss are 3 times more likely to have a fall. And 15 to 20% of those people experiencing a fall result in a pretty significant injury. There are various kind of theories or research on this, but it definitely comes down to reduced attention, too much cognitive overload, and the overall lack of awareness in our environment. So when the brain is spending so much time and effort to try and listen and hear, it doesn't have the same effort for our fine and gross motor. Any questions at all yet as far as these couple of medical conditions so far? Just let me know. So next slide. So type 2 diabetes also increases our risk of hearing loss. In fact, hearing loss is about twice as common in adults with type 2 diabetes compared to those without. So if we're talking about people over 60, now we're at a 66% chance of having some form of hearing loss. And although patients who are recently diagnosed tend to have normal hearing, they almost always suffer to progressive or sensory neural hearing loss. And the studies of these diabetic patients show that sensory neural hearing loss is caused by damaging the nerves and blood vessels of that inner ear due to the pathology changes within diabetes.
Dr. Stakiw, I do have a question.
Okay.
Is there a correlation between high blood pressure and ringing in the ears?
There's more of a correlation between the medication you take for high blood pressure than the diagnosis itself.
Thank you.
All right. So next slide. So this is probably one of the most talked about studies that we're seeing all of the time, is the correlation between hearing loss and cognitive decline and dementia. So persons with damaged hearing cells cannot send the same information to the brain as those with normal or healthy hearing cells. And so a study published in the Journal of Neuroscience shows that when these messages are not being sent to the auditory cortex properly, we begin to see atrophy of the gray matter. So this tends to occur more in older adults because hearing loss tends to occur more in that population as well. So persons with hearing loss show less gray matter in our auditory cortex than people with typical hearing loss. And so MRIs pick up healthy gray matters compared to white matters, and that can be the very first sign of a cognitive decline disorder or diagnosis. So if we go to the next screen, this is an example of a brain on the left side with hearing loss that's been untreated, and a brain on the right side that shows either normal hearing or treated hearing loss. So if you're able to see, all of the energy on that right side is bright and green and encompassing most of our brain, whereas the left side, the amount of active neural energy is much less. So brain atrophy is a condition that occurs when there's damage to these connections between the brain cells. And so people with brain atrophy will not only suffer cognitive decline, but they'll have more difficulty understanding speech, and they have to work harder to hear it and absorb that sound. Okay. So next slide. So this is talking about, now that we know that hearing loss is linked to cognitive decline and dementia, there's also a strong link between the amount of hearing loss you have and the risk of developing dementia. So people or individuals with mild hearing loss are twice as likely to develop dementia as those with normal hearing. But if a person were to have moderate hearing loss, they are 3 times more likely to develop this condition. And those with severe to profound hearing loss are 5 times that risk of someone with normal hearing. So I think that kind of speaks volumes of how important it is to not only establish baselines in hearing, but to treat our hearing as soon as possible. And next slide. So this is kind of talking about, well, then at what age would someone develop cognitive decline or cognitive problems? And so if left untreated, it's 3.2 years sooner than the average person. So we really do recommend not only having baseline hearing exams done, but when you're told that there's a treatment for your hearing loss or told you're a candidate for a hearing aid, the sooner the better, because the old use it or lose it phenomenon definitely applies quickly to the brain or in that 3.2 year window. Okay, so next slide. And so everyone wants to know exactly how does this work? And there's kind of 2 different ways in which the cognitive decline shows up. And so the first reason is if our cochlea or our hearing nerve is sending a very damaged, garbled, difficult to understand signal to our brain, the brain has to work much harder and rededicate different cognitive resources to deal with it. So that leads to a reduction in our fine and gross motor, in our memory, our decision-making, and our reaction time, because the brain is so focused on trying to make sense out of this signal that used to come in so crisp and clear and no longer doesn't. And so this actually starts to lead to those permanent structural damages or changes to the brain. So the atrophy first starts in the temporal lobe or the auditory cortex, and that's because this is the part of the brain that handles our speech, language, hearing, and sound processing. The same area of the brain also handles other parts of our language and memory, which is why we start to see decreases in those functions as well. Okay, any questions on that at all?
I do have a couple of questions that came in. Going back a little bit, total of 3 questions. So first one is there any correlation between smoking and hearing loss?
There is. So obviously, smoke, we decrease our oxygen throughout our entire body. And anytime we have reduced O2 and damaged blood vessels, we're going to have that same response within the ear. Because the ear vessels or blood vessels are so very tiny and minute, they're one of the first ones to become damaged. So absolutely.
Very
And
good.
tobacco also increases tinnitus. So if anyone has sounds in their ears, for one of the first substances we'd want to eliminate would be tobacco and nicotine. So
Very good. Second question, does dementia cause hearing loss or vice versa?
So we can't do anything about the genetic component if you carry that gene, right? What we're saying is treating the hearing loss can reduce that risk of dementia by up to 60%. And so I don't think people realize the connection between hearing loss and brain health, or that treating your hearing loss, whether it is with pharmaceuticals or surgery or hearing aid, is a viable option for this.
Thank you. Last question for now. Do hearing aids help reduce the progression of dementia?
Right. So they absolutely do that as long as they're being worn at least 6 hours a day or on a routine basis. Because by keeping the blood supply and the nerve endings firing to the brain at a normal level, we reduce that risk of atrophy. Right. So that's, although hearing aids can't slow down the progression of hearing loss because we can't control your family genetics, it absolutely is the treatment for sensory neural hearing loss and reduction of cognitive decline.
Thank you so much.
All right, so next slide here is, so obviously not only does hearing have connections to a lot of different disease processes, like we've talked about, diabetes, cardiovascular, dementia, but it also can definitely affect us psychologically as well. So there are many feelings of social isolation, depression, anxiety, frustration, and fatigue. And the reason being is there's different stages of hearing loss. When a hearing loss is very mild in nature, it creates frustration in our day-to-day relationships. So I have to ask you to repeat, you're getting tired of repeating. So what am I gonna do? I'm gonna quit asking you, right? Because then I avoid that conflict and frustration. So what we see next then is social isolation, right? So if it's difficult for a person to hear in a busy or noisy restaurant or a movie theater or at a friend's house when we're playing cards, well, then we start to avoid that area. We don't go to that restaurant. We don't go to the movies anymore. I don't like to play cards. When in reality, we don't need to change or decrease our quality of life and the activities we love when hearing loss is one of the diagnoses that is actually very easily treatable in the scope of many things in our world today that are not. So we want to avoid social isolation, which obviously increases our risk of anxiety, depression, and frustration. We want to keep our social interaction as high as possible, which again stimulates the brain ultimately as well. So, all right, so next slide. So hearing loss is not only psychological, but obviously it increases our risk of cognitive impairment, our depression and anxiety, but it also increases our risk of early mortality. And one of the main reasons for that is not hearing different instructions or the way that we're supposed to take a prescription, not hearing our pre and post surgery options when we're at a hospital or we're having a procedure. And again, today is not meant to be intimidating or scary, but rather educating, so that we know why wouldn't we get a baseline for hearing when we get a baseline for blood pressure and weight and vision, and why would we put that off? So that's kind of the main purpose of today, is to educate you so you can make the best decisions for yourself. So next slide. So this is kind of what I was talking about before, is that individuals with untreated hearing loss are actually 50% more likely to experience a hospital stay, and they have a 44% higher risk of being readmitted to the hospital within 30 days. And this was one of the main key parts of the Better Build Back bill from last year, that was trying to get coverage for Medicare people for dentistry, vision, and hearing, because it's showing how much money the government could actually save in hospital visits if we treated something like hearing. So hearing loss is just connected entirely to our social beings, physical beings, and psychological health. It affects all areas of our life, our friends, family, caregivers, anyone who interacts with us on a daily basis. All right, so we'll start first about those physiological effects of hearing loss. So people with hearing loss, next slide, is who have to work harder. Their brain is always on high alert. You know, they'll notice that they lean forward. They're really watching the face and watching for those facial cues. At the end of the day, that ends up being extreme tired and exhaustion. We can see headaches and stress. Sometimes we're not sleeping well, or we over or under eat. The ability to not concentrate in a busy environment or not finish a task. And then some of those side effects can be high or low blood pressure, and then some of those gastrointestinal or tummy problems as well. So at the end of the day, people who have untreated hearing loss, their bodies and brains are working much harder than they need to, because the brain is reallocating that cognitive load. So if we go into the next slide, it shows, again, some of those psychological effects of untreated hearing loss. People with untreated hearing loss tend to guess a lot at what another person is saying. So whether they heard, the word neck or a bird's nest, that conversation can really go off on a different tangent. And that can lead for some people to be embarrassed, or to be, to be angry at the situation. That also leads to some reflective sadness and depression, anxiety, the ability to be super critical and self-aware on areas that they're not performing well. But more recently, in the past 5 years, studies have shown that results, especially concerning to women, while all older people with hearing loss were found to have high self-reported rates of depression and social isolation, women, particularly between 60 and 69 years of age, were statistically significantly more affected by their untreated hearing loss. So it does tend to affect us women more than men as far as our psychological effects. And then next slide, lastly, is socially, how does it affect our day-to-day? Obviously, it's going to affect how we participate in activities. Are we the life of the party, or do we tend to kind of stay to the back? Do we communicate with our friends and family and spouse the way we want to? Do we ask for repetition or clarifying things, or do we not, to avoid an argument? It's shown that people who have untreated hearing loss actually make less money at employment than others, because they don't always want to climb the social ladder or the hierarchy of work, because they don't want to be questioned. So we really want to avoid this isolation and this withdrawal of ourselves. And again, that frustration can definitely lead to overall strained relationships in our entire life. So if you go to the next slide, it kind of just shows that if we treat hearing loss overall, or at least are educated about it, we can reduce huge health risks, and we can also just have a higher quality of life with our friends and family that reduces that risk of social isolation. All right, so next slide. Well, how do we do this then? How do we protect our hearing? And so the first thing obviously would be noise. And this is just a great graphic of how our little hair cells stand up nice and healthy on the left side, and how after even one exposure to loud noise are not only laying down, but are less in number. So we need to be aware and avoid harmful noise. So anything over 90 decibels is considered damaging. And it doesn't take numerous or multiple times to do this. So we want to wear things like ear protection. So muffs if we're around big tools and weapons, control the volume of our headphones or AirPods. And we want to remember to either remove ourselves from the situation or to wear that adequate noise protection. So the next slide shows that 1/3 of all the hearing loss that we would see in the clinic is actually caused by noise exposure. So we have a contract with our VA, with CDOT, with CBI in the state of Colorado. So we see a lot of these workers that are affected by noise. And we want to make sure that you're aware that you want to have the proper ear protection. So things like foamies, the little ones, we don't reuse those, right? If it's something that you do on a routine and regular basis, we would recommend wearing custom ear protection. So we can make that for you at Rocky Mountain Audiology with a quick impression. And that way that ear protection would fit you for the rest of your life. And you know that it's going to have adequate protection for you. So people like musicians and vocalists and singers, or our workers in the construction industry, anyone who likes to fire weapons, or just those of us who go to live music or live sporting events. The average Broncos game is between 110 and 120 decibels. So making sure that we're wearing proper ear protection in some of those environments that we may not think of. Okay. So the next slide would be discussing the fact, so we do have hearing loss. Now, what would we do, right? So like I talked about, people usually take up to 7 years to come in for an evaluation. And once they're diagnosed with hearing loss, still only 15 to 20% of those wear a hearing aid. And I think a lot of people think that it's due to financial constraints. That's not what I see in our office, because we actually have a program at Rocky Mountain Audiology called The Gift of Hearing, where if you don't have adequate insurance or you don't have the financial means to purchase them, we'll provide them at no cost to you. So please keep that in mind for yourself or family members who feel like it is a financial constraint. But more often than not, it's not put off due to financial constraints. It's usually put off a little bit more to ego and not being ready to wear it. So although it's very socially acceptable that people wear glasses, for some reason, certain populations think that there's a stigma attached to hearing aids. So my goal in this next part of the presentation is just kind of break down hearing aids and how easy and simple of a treatment that this can be for the majority of us with hearing loss. So the next slide.
Excellent. Before we move on to the next one, we do have a question that's been holding on.
Okay.
If it's a good time to pause for that. So it is about hearing aids. So if the hearing aids are inexpensive, are the inexpensive type rather, that are simply amplifiers, not exactly matched to the spectrum of loss, are they better than nothing?
So we'll kind of talk about this because I'm going to kind of talk about over-the-counter hearing aids and the new bill that was passed a little bit. The problem with amplifiers is if they're not programmed for you, they can actually cause damage to ears. So we would want to still have a baseline audiogram so we would know whether you are a candidate for an over-the-counter or whether you are a candidate for a prescription hearing aid. So I would always start with that diagnostic evaluation first before we would kind of make a general treatment recommendation for you.
Thank you.
Okay. So, so like I said, if hearing loss is the third most chronic condition in the United States, with heart disease being 1 and arthritis being 2, hearing aids are also the second most used assistive devices. So although some hearing loss is medically treatable with prescriptions or surgery, if you have your diagnostic evaluation and we find out that your hearing loss is permanent or what we call sensory neural in nature, then we would want to move forward with hearing aids. So if you go to the next slide, here are just some interesting facts about hearing aids. Again, only 1/3 of the patients who need hearing aids actually wear them, but 83% of those people who wear hearing aids have a high satisfaction with them. And in adults over the age of 45, men are actually more likely to wear a hearing aid over women. And hearing aid usage has increased 16% in the last 3 years. And a lot of people kind of ask me, well, what is the average age for hearing aids? And I would say at my clinic right now, it's probably 45 to 60. The sooner that we treat with hearing loss, the easier it is for our brain to acclimate and adapt to the incoming sounds. So again, over 30% of people don't wear hearing aids because they feel like there is some stigma associated with hearing loss. But yet 83% of the people who wear them describe high satisfaction with that. So I was just going to describe in the next couple slides what a visit would look like, how easy it is, not scary. So next slide. So to be the most educated person you can be, we want to make sure that you're getting tested. And so if you're a Medicare patient, that requires a referral from your primary care specialist to an office so that they will cover that. So we would have you first have a hearing test done, and that would be by a board certified doctor of audiology. And a lot of people will ask me, well, can't I go to Costco or Sam's Club? You can, but in the state of Colorado, a hearing aid dispenser only has to have a high school diploma. So if I'm going to go for my first time and just have a baseline done, I would want to have it done as accurately as possible. So what we would do is first complete our diagnostic evaluation of that outer, middle, and inner ear. And then we would want to see if, in fact, you are even a candidate for a hearing aid, or if it's something we just need to monitor over time. The next thing would be to discuss where in your lifestyle you're having difficulty and where do you spend your time with friends and family, because hearing aids really need to match up to a person's lifestyle to be effective. So in kind of reference to that last question, when someone's asking, is something better than nothing? If someone actually has a very busy lifestyle and purchase an amplifier, they could perform poorer than they would like to. So for some reason, those little next stages aren't showing up on my screen, but there's, if you could push that a couple times, maybe there should be, there we go. So just kind of showing the stages of what happens as we have a hearing test, have a discussion, discuss options. So we can go to that next slide. So again, each visit is going to be individualized for that patient, but to know that you typically have insurance coverage for establishing a baseline audiogram is key, so that there isn't an out-of-pocket for you, okay? And even if a person were to not have insurance, you know, you're in the $80 range for a baseline audiogram, okay? So the next slide shows kind of how to read this graph. Is across the bottom axis shows if we are wearing newer hearing aids, so less than 5 years old, we have almost an 80% satisfaction rate. if our hearing aids are over 6 years old, we're dropping down a little bit more to that 67% satisfaction in listening environments. And if we've never worn hearing aids, our satisfaction in listening in situations is 42%. So basically just showing that the changes in technology for hearing aids have increased significantly. One of the main questions I get a lot is how do hearing aids keep up in the world of technology? And hearing aids update every quarter, just like your cell phone does. So we'll be updating them with you so that if you bought a hearing aid 5 years ago, it would still be up to date with technology. But that is something new since 2020, or the ability to keep our hearing aids firmware and software updated. Okay, so the next slide shows where we tend to see some of the improvement in the quality of life when we wear hearing aids. So this is a graph showing the percentage of hearing aid users who showed an improvement in their relationship, 65%, in their self-esteem, 62%, in just overall life improvement, 65%. And for most of my patients, this increases their sense of independence, which is showing about 41% today. So again, the goal of this presentation was to show that hearing and hearing loss affects our entire being, and hearing aids don't just help us hear. They don't just reduce the risk of dementia. They help increase our quality of life, our self-esteem, and overall our sense of independence in who we are as we age, which is something that can be reduced for us involuntarily. So next slide kind of just shows us, well, what do new hearing aids look like, right? So hearing aids come in all shapes and sizes, but this is merely a cosmetic concern, meaning if you want the tiniest hearing aid possible, there's no price difference between that one and a medium or a large one. Hearing aids these days can be Bluetooth, they can be rechargeable, but most importantly, they are programmed to your individual age, gender, hearing loss, anatomy, and we take all of those measurements to ensure that we're hitting prescriptive target. Because if we're not hitting prescriptive target, then we're not stimulating the brain the way that we need to be. So that is a huge goal, the way that board certified doctors of audiology fit hearing aids compared to other arenas or avenues. So what does then make a difference in how hearing aids perform, and also the cost of hearing aids, which I know is a big question for many of my patients. So if we would switch to the next slide, inside of the hearing aid is the digital chip. And that digital chip is what controls the performance of the device, but it's also what controls the price. So what we would do is sit down with you to go through this selection process that shows there's 4 different levels of technology, and selecting that proper hearing aid to match your lifestyle is very, very important. We haven't touched much about tinnitus because it really is its own discussion or beast, but clinical research shows that when you wear a hearing aid that has tinnitus therapy into it, we have a reduction of 80% of tinnitus. And so everyone who has ever heard from someone in medical or healthcare that there's nothing we can do about tinnitus, this would be false. So that would be something we would love to do an evaluation for and teach you about the different ways to reduce our tinnitus. So if we just go into the next slide, this kind of shows our higher end hearing aids. So our premium hearing aids who have microphones that can hear 360 degrees around us. And they're meant for the person who is in pretty complex and varying lifestyle environments all day. So whether they're going from their car to a meeting, shopping, church, outdoors, lunch, more challenging listening environments. For advanced hearing aids, we now only can hear 180 in front of us, so front and side, so that if someone was in the car beside us, or they were on the couch beside us, or going for a walk, we would have the microphones to hear you. This is going to still help in our big social environments, in music or movie theaters, travel, and restaurants. But there are 2 more levels of hearing aids, and that would be on our next slide. And this is going to be more of our standard or entry level hearing aids. So standard and entry level hearing aids have microphones that only point forward. And so as long as we are typically in a one-on-one environment, these hearing aids work just great. So when we're talking about lower level, it would be far better to go with an entry level hearing aid that's programmed for you than just an amplifier. So hearing aids typically last about 5 to 7 years. They come with international warranties for 3 years for loss and damage. Everyone always wants to know if they come with a trial period. Absolutely. Colorado state law is a 30-day trial period. But at Rocky Mountain Audiology, we always offer loaner or demo hearing aids. If you're kind of on the fence and you don't know, you can come in, try one out for a month or 2 and see what you think. So we have finance plans, we bill insurance, and then like I said, we always have that gift of hearing program for our locals of the Valley who need help. You can simply call or email us for an application, fill it out, tell us why you need hearing aids, where they would help you, and we pick those every quarter. So next slide, like I said, kind of talks about the main differences between an over-the-counter hearing aid and a prescription hearing aid. So over-the-counter hearing aids are really meant more for our tech-savvy individuals, usually between 40 and 50, with the very beginnings of mild hearing loss. They're not quite ready for prescriptive devices, nor do they necessarily need it. But I think people are shocked that the average over-the-counter hearing aids are still $1,000 to $2,000 when you can get into an entry-level hearing aid prescribed for you at around the same price. So over-the-counter hearing aids are not appropriate for children. And that's because with kids, we really want to dive into the cause or the root of that hearing loss, whether it was congenital, if there is any malformations or genetic components. We want to make sure our ENTs and speech paths and teachers are all involved in that process as well. As far as the design of hearing aids, when you're fit with an over-the-counter, it's going to be you get what you get, as opposed to one in a clinic or hospital is going to be measured for you based on your anatomy, your ear size, your ear canal curvature, those types of things. As far as return policy, like I said, state of Colorado's 30 days for a prescriptive hearing aid, but anything that's purchased over the counter, Amazon, those types of things, there would be no return available for that patient. Probably the main or the most important reason why we would want a prescriptive hearing aid is for verification, that we can verify that we are hitting our medical target of amplification, that we know if your hearing loss is here, we were able to take you up to there. And unfortunately, when we're fitting ourselves over the counter, we just wouldn't know if we've hit that target because we wouldn't know what that target is. So over-the-counter hearing devices are really meant for those mild to moderate hearing losses, where prescriptive hearing losses, we can kind of fit the gamut of mild to profound. So I just think it goes through a little bit of showing that research shows that people who wear hearing aids and see their audiologist, 1 to 2 to 3 times a year tend to have more satisfaction because their hearing aids work better. They understand how they work. They know how to do their basic care and maintenance at home, but they also know that there's a medical professional that they can come in and ask for help with as well. So lifespan of traditional or prescriptive hearing aids is in that 5 to 7 range. Right now, they're unknown for over the counter, but they're estimating about 12 months. So I just think in anything that you purchase medically, you would want to know the training of that person who's helping you. You would want to know the business that's standing behind their product. And so right now with hearing aids, the top 6 manufacturers are all European. So Denmark, Switzerland, Germany are our big companies right now as far as our top 6 prescriptive hearing aids. Does anyone have any questions regarding over-the-counter or prescriptive hearing aids or things they may have heard or would like answered? Okay, well, the next slide, this just kind of shows what a audiologist does all day. So although hearing is one part of it, or what I talked about today, we could sit and chat all day about, you know, the interesting field of audiology. So it is an 8 to 9 year degree program. We have the ability to treat tinnitus, cochlear implants, clean wax, obviously balance and vertigo. So if you are having any of those symptoms of any of those, please touch base with your primary care, give us a call, send us an email, and we can certainly chat about that. But hearing today was just one facet that we were going to discuss with you guys. So kind of last but not least, you know, hearing is such a complex process of sound and attaching meaning to it. And it's critical to hear, to understand the world around us. So we just wanted to let you know that we are here to help you hear life again. On the next or our last slide is my email. You're more than welcome to chat with us with any questions or clarification that you may have. And I'd love to hear from you.
Perfect. We do have a couple of questions, and before we go into those, I do want to say that this is being recorded and the video will be available soon. I will also be emailing this presentation to everybody who registered today. We do have 2 questions, like I mentioned. First one, is there any insurance that covers prescriptive aids?
Absolutely. So again, most of our group insurance plans. So if you work for a business, so Aspen Valley or Valley Medical Center or the school districts or the ski hills, they tend to have coverage more so. Once we get into Medicare plans, Medicare covers diagnostic testing and it covers surgeries. But some of the supplemental plans do have discount plans, right? So the difference between an insurance funded plan means they're actually paying for some of that device, where a discount plan means they're still able to knock it down at a contracted rate. So you can always, if you do have questions, like I said, shoot us a copy of your insurance card and we can let you know if you do have a funded or discount plan for hearing aids. Absolutely.
Perfect. Next question is balance and vertigo more common in people with hearing loss?
Yes, because the hearing and the balance center, the vestibular center organ, we call it, share the same cranial nerve to the brain. So a lot of times see damage or inflammation in one, we can also see it in another. If you are ever vertigo, which is that sensation of spinning, it is very important that you have a checkup. So certain medications can cause dizziness or lightheadedness or unsteadiness, but true vertigo or that spinning sensation with nausea is definitely something you want checked out.
Very good. And what are the advantages of a Bluetooth type hearing aid?
So a couple of the advantages are, one, a Bluetooth hearing aid allows you to connect your smart device, right? So on this device, you would have an app and you could make changes to volume, or if there's too much noise, you could turn it down. Or if we go back to wearing masks, it could have a mask mode. But probably the number one reason Bluetooth is so popular because it has a GPS Find My Hearing Aid button. So if we misplace our hearing aid or our puppy gets it, or we fling it off with our mask, that we would be able to find it. It also allows me as the audiologist to have remote assistance to you. So if you live a couple miles away from the office and you can't that day, I can still help you with your hearing aid. Or if it's snowy or you don't have transportation, we can do a full diagnostic of your hearing aid right from our office without you having to come in. So for instance, my whole family lives in Canada, so my dad wears hearing aids and I can do all of his hearing aid adjustments remotely. And then the last reason for Bluetooth is that's what keeps our hearing aids updatable. So if we buy a hearing aid in 2022 that doesn't have Bluetooth in it, then we don't keep updating in technology. And so just like your iOS on your iPhone or the Android version on your smartphone updates your technology, that's how the Bluetooth updates hearing aids. So for most of my patients, whether they're tech savvy or not, Bluetooth tends to be very popular. It also allows connectivity to your TV. So I know in my parents' house, there's always an argument about the volume of the TV. Bluetooth allows that to stream wirelessly to your hearing aids. So it doesn't matter what volume anybody wants it on. They can control it themselves. So yeah.
Very good. And I think we have a final question that is a good final question for our presentation. It's simply, what's coming down the pike with hearing aids?
Well, I think what's coming down the pike for hearing, period, is there are a lot of trials right now on injections into the inner ears, stem cells at Harvard, Stanford, and Yale to repair some of these damaged nerve endings. Right now, it hasn't been successful, but our VA definitely has the most money invested in it because of all of our veterans coming back with noise exposure, hearing loss, and tinnitus. So I think that will be something. They've tried transplantation of outer and inner hair cells, and that has not been fruitful either. As far as what's coming down the pipe, as far as hearing aids, that, like I said, is something that's just changing every couple months. And that's the importance of having a conversation with your audiologist so we can keep you updated on that type of thing. But again, if price is a concern, if there's one thing I can offer to you, like I said, is this gift of hearing program. I probably fit about 20 plus individuals, and you have to be a local to be fit at no charge every year over the last 15 years easily. So if you have a concern and we can help, we will sure do our best to do that. So anything else anyone can think of?
Perfect. And we are coming to the end, so we can take these last couple of minutes to answer any last questions, or if anybody's got any comments about our presentation today. As I mentioned, this is being recorded. If you missed the beginning of the presentation, you'll have access to the video shortly.
Yes, if I may, I have to say that I do wear hearing aids. Thank you to the good doctor. And it's made a difference in my life, but I see many of my friends, colleagues, and relatives that it's totally clear to me that they really need to go in and have their hearing tested. And it's disturbing to me that when they go in for a checkup, their physician doesn't insist at a certain age that they should get a hearing test as part of their normal checkup. Is my experience with that the usual thing, or not?
So I've spent my entire life trying to educate physicians to understand the importance of hearing, and that it is affecting your entire being. And so we recommend 5 as being the first year you should get a baseline audiogram. And then every 3 years from there until you would be diagnosed with hearing loss. But once you are diagnosed with hearing loss, it is imperative that you're monitored annually, whether you wear hearing aids or not. Kind of like how I mentioned before, the ear really is a window to the entire body. If you have a prescription change, or you have tinnitus start, or you have a head injury and your hearing changes, or you have a fall, we know what was for, so we don't have to run tens of thousands of dollars of tests to determine what caused this difference or change. So I absolutely agree. We should be testing much sooner. We should be testing annually. And I challenge you to have your friends and family come in for a baseline. What's the worst thing that could happen? You'd be educated on your body, right? I mean, that would be the worst thing that could happen. So
yeah, well, I've been trying too.
I wanted to ask a couple of questions, but first of all, thank you for an incredibly informative program. Really appreciate it.
Oh,
I had Costco hearing aids for many, many, many years, and I can't tell you what a difference the hearing aids that we now have are incredible. It's made a lot of difference. But what I wanted to ask you about children. My son-in-law had severe hearing loss for his entire childhood. And it affected him in so many ways. He couldn't do well in school. He felt, social isolation. It was just very devastating. And he now is, for the first time in the last 5 years, has gotten hearing aids that have just transformed his life. So I was wondering what schools are doing about giving hearing tests to children at very early ages.
so Colorado was actually the very first state to begin newborn infant hearing screening, meaning our babies have to be tested within 48 hours of birth. And so I'm actually the newborn infant hearing screen coordinator. Slope. So any baby that's referred from Denver West, on the outside of Denver West, I would be in touch with those parents as to what the next step would be. So if we refer at birth, we're going to have a diagnostic test called an auditory brainstem response, or ABR, because obviously with infants, we have to test objectively because they can't raise their hand or push a button, right? So all of that's done objectively. If we follow the state guidelines of identification by 1 month and treatment by 3 months, then by 6 months, our babies are up to goal or up to normal standards for speech language production, for emotional. So we really run the risk of keeping our kids at par if we follow those guidelines. So then we miss our babies that are born at home, right? So it's imperative that if you know of a home birth, that we still have a screening done. From there, we are not tested in the public schools till kindergarten. So in kindergarten to ninth grade, we are tested every other year. So first, third, fifth, seventh, and ninth. Ninth grade is the last year you're tested in public school. But for a lot of our kiddos in this valley that go to private school, there's no testing being done. So it's important that we recognize that kids should be tested every year or 2 at the very most, because we run the risk of genetic progression hearing loss that starts at the age of 3. Also middle ear fluid and needing PE tubes so we don't have delayed speech and language. Just debris in the ear, bees, anything else our kiddos stick in there. Somebody should be looking in that ear and testing it every year or so. And so again, public schools do a pretty decent job, but if we're not going there, we need to get into an audiologist. So we tend not to see delayed speech and language or quote deaf speech. We're not seeing that as often because of these testing protocols we have in place with the state right now. So
Amazing.
Yeah, that's terrific. Well, I want to say we're going to make sure that the people that need to hear this get copies of this video, and there are quite a few that have folks who have requested it. So thank you again, and we sure do appreciate it.
oh, thank you, lady.
My son-in-law competes internationally in pickleball. So
Oh.
you probably come across him. It's just become the rage, It's wonderful.
It's fun. If you haven't tried it, you should try it.
Okay. Thank you so much.
Thanks again.
Thank you guys.
Bye-bye.
Have a good night.
And I just wanted to say, if you wanted access to the video now, since we are streaming live through Facebook, if you visit the Garfield Library's Facebook page, the video is on there already.
Oh. Well, thank you so much for your help as well.
Thank you. Have a great night.
You
Thank
too.
you, Alex.
Night.
Good night.